Welcome to British Biomedicine Institute. Today we will explore neuroimaging and neurointervention and radiodiagnosis. Using medical imaging technologies like X-ray, ultrasound, MRI, and CT scan, radiology has become an important part of the diagnostic process within neuroscience. Neuroradiologists use images to help diagnose nervous system disorders, including diseases of the brain, spinal cord, nerves and muscles. CT scans use a combination of X-rays and computer technology to provide comprehensive images that help detect a number of neurological conditions, such as acute stroke, intracranial bleeding, aneurysms and other vascular abnormalities, brain tumors, and bone abnormalities of the head and spine. CT scan is also great for head and neck imaging, including assessment of the paranasal, sinuses and temporal bones, and staging or diagnosis of head and neck tumors. MRI exams use radio waves in a strong magnetic field to provide very clear images of the body, without ionizing radiation. MRI is best for diagnosing and monitoring many neurological conditions affecting the brain, such as multiple sclerosis, infections, brain tumors, vascular abnormalities including acute stroke, and intracranial bleeding, and for assessing the orbits and pituitary gland. It is also excellent for diagnosing spinal cord abnormalities, including demyelination, tumors, or disc herniations, and degenerative changes. Some neuroradiologists are also trained to perform spine intervention procedures that treat neck and back pain. Cerebral vascular reactivity imaging in MRI - a technique that is used to assess impact of steno-occlusive disease of neck and brain vessels for endovascular and surgical revascularization. It is a most challenging subspecialty because the human nervous system is such an intricate and complex network of fibers that spans the entire body and functions in complicated and even mysterious ways. Thank you for showing interest in British Biomedicine Institute Skilled Non-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.